Methods of reduction. So the methods of reduction of the shoulder dislocation. So this is the topic we are going to discuss. So starting off with questions. The first question is, what is Kocher's technique? Question 2, what is Hippocratic method? The third question is, what is happening in case of the Stimson's gravity technique? So in this video, we will make sure that you know all the answers in the end. Firstly, we look at the Kocher's technique. So what is Kocher's technique? So the mnemonic here is steam. So T for traction, then comes the external rotation, followed by the adduction, and as well as the medial rotation. Then we look at the Hippocratic method. So the Hippocratic. So in terms of the Hippocratic method, first there is that the doctor applies firm pressure. So the doctor applies firm pressure and steady pull, firm and steady pull, and steady pull on the semi abducted arm of the patient, and this is by keeping his foot, this is by keeping his foot on the axilla, by keeping his foot on the axilla and against the chest wall. So the foot is used as the fulcrum. So if you see the foot, it is nothing but used as the fulcrum. So this is nothing but the Hippocratic method. Next, we look at the Stimson gravity technique. So in case of the Stimson gravity technique, so in case of this, the patient is left in prone position. The patient is in prone, is left prone, and weight is attached. The weight is attached to nothing but the elbow, okay, or the wrist on the affected side. Next, the gravity stretches the muscle. The gravity, if you see, gravity, it stretches the muscle. And a reduction, so there is reduction. This occurs in 15 to 20 minutes. So now we are just going to answer our questions. So the first question we asked was, what is the Kocher's technique? The Kocher's technique is nothing but there is a mnemonic, that is steam. So here T stands for traction, E stands for external rotation, abduction, and the medial rotation. So just to write it down, traction, external rotation, then there is adduction as well as the medial rotation. Next, we have the Hippocratic method. Hippocratic method. So what is the Hippocratic method? The doctor, he applies a firm pressure and steady pull on the semi-adducted arm. So there is a semi-abducted arm where the doctor applies the steady pull. So he applies a pull, and the patient of the semi-adducted arm of the patient by keeping the foot on the axilla. So the foot is kept on the axilla, and this is against the chest. So the foot here is acts as the fulcrum. So this was the Hippocratic test. Then lastly, we look at the Stimson's gravity technique. That was the question. So in case of Stimson's gravity technique, so here the patient is left in prone position and a weight is attached. So weight is attached at the elbow or the wrist of the affected side. So what happens is the gravity pulls it downward, and there is nothing but reduction. There is reduction which occurs in about 15 to 20 minutes. Now looking at our bonus questions which can be answered in the comments. So the bonus question is only a simple question. What are the other known methods? Other known methods in the reduction of the shoulder, in the reduction of shoulder dislocation. So this can be answered in the comments.